I'm frequently the first person or one of the first people that people will meet at their what I call a marathon, in their treatment for cancer. Oftentimes when patients see me, they've had a CT scan or an MRI scan with various different words: a lesion, a mass, a abnormality, an irregularity, a thickening, because people don't want to use the C word oftentimes until you know exactly what it is. And so I spend a good deal of time talking to patients and their families and trying to understand essentially where they're coming from with this specific diagnosis. This may not be their first run-in with cancer. This may be something that's coming back after a long time. And so we spend a lot of time trying to understand where they're coming from with their specific experience and trying to understand their specific concerns. Some of those concerns are, is this cancer? If it is cancer, what are the treatments that will be available to me? What are the side effects that I could hope to have? And is this going to be life-limiting for me? God forbid. And we work through each of those issues, and we provide them resources for them to educate themselves about. And we work with all of our partners in the Siteman Cancer Center to help allay all those fears one by one as best we can. I believe that the patient is at the center of their own care. What our job is as physicians and as oncologists and as gastroenterologists, as pulmonologists, whatever field we are in, is to provide the best information and the best science in the most accessible way for patients to make a completely informed decision about their own health care. And that could mean participating in a trial. That could mean in participating in chemotherapy, radiation therapy, surgical therapy, or deciding even for palliative therapy if that's what's appropriate. Our goal is to make sure that the patients feel comfortable in their decisions and their families feel supported through the entire journey. I think one of the things that patients sometimes are fearful of in coming to Siteman is that can be a daunting place. And I think we do a really good job of trying to make care accessible. That means accessible on an individual level and being able to talk to people where they're at, but also to meet patients where they're at. And we are increasingly, as a group, going to see patients in South County, going to see patients in West County. We have now Siteman, Illinois, and we work very closely with those partners. And that all goes into this larger philosophy of being an integrated cancer center, meeting patients where they're at, both up here, in here, and wherever they are in the community. Multidisciplinary care is at the center of essentially everything we do for a patient. So before a patient even arrives, frequently their chart has been reviewed by multiple experts and in trying to figure out what the best way forward is for that patient. Oftentimes their case is reviewed in a multidisciplinary conference before they even see their first physician here to best figure out and streamline for them who they should be seeing and what they should be doing to kind of efficiently get to care. I think one of the things that patients are frequently surprised by or impressed by is just how collaborative we are in what we do, because it takes a huge team to beat a foe like cancer. It takes people on the diagnostic side, on the therapeutic side. It takes people, from the surgical oncology side, from the medical oncology side, from radiation oncology. This is why Siteman Cancer Center is so big, because it encompasses essentially all the fields that you require to be comprehensive in treating a disease like this. I'd say in my field, the most rewarding thing that we can do for patients is to identify cancer at an early stage and to be able to potentially cure it or remove it with a procedure as simple as an endoscopy, completely obviating the need for chemotherapy, surgery, or much more invasive or debilitating treatments potentially. Identifying those sorts of lesions at the earliest possible stage and intervening upon them before they develop into cancer really is the holy grail of what it is that we do. The real reason I became a physician is because I believe that our goal on Earth is to reduce human suffering in some way, to make people's lives better in some meaningful way every single day.